Like human babies, puppies and kittens are at high risk of contracting life-threatening infectious diseases. Cleverly, protection is transferred from mum via antibodies acquired through suckling shortly after birth. But the number of antibodies acquired can vary greatly amongst littermates and wanes to an unprotective level within a couple of months. This is why vaccinations play an essential role in keeping your puppy healthy. The core vaccine for dogs protects against canine distemper, hepatitis, also known as adenovirus, and parvovirus, which can all be deadly. Puppies need a course of 3 vaccinations from around 6 to 8 weeks of age. There are additional vaccines for parainfluenza virus and Bordetella bronchoseptica. These are called non-core vaccines, and they reduce the symptoms of a disease commonly known as canine cough. We used to call this disease kennel cough, but it isn't just dogs in kennels who are at risk. Anywhere dogs interact in close proximity, like doggy daycare, puppy preschools, grooming salons, and even dog parks or communal water bowls can be a source of infection. Canine cough affects the respiratory system and causes a persistent dry hacking cough, which in some cases can progress to pneumonia or chronic bronchitis. Other symptoms include sneezing, a runny nose, or eye discharge. As the level of immunity can decrease over time, it's important to keep your dog's vaccinations up to date. This not only protects your dog, but when enough dogs in the community are vaccinated, it then helps to control and prevent the spread of deadly infectious diseases throughout the pet population. But with owners moving away from vaccinations, we've seen some cluster outbreaks of parvovirus and other diseases in recent years. There's a lot of discussion about the potential adverse effects of vaccinations, and as a veterinarian, we have a duty to both the pet and the owner to objectively examine the current scientific evidence available. Like the vast majority of vets around the world, I recognise that whilst adverse reactions do exist, the benefits of protection far outweigh the slight risk of a vaccination reaction. I've treated dogs with parvovirus. It's heartbreaking. Even with the best treatment, some will die. The worst thing is that it's a preventable disease. You may have heard of titer testing for antibody levels to decide whether a vaccination booster is required. This is now available, but only for the core diseases and not for the non-core. So it's important to talk to your vet about your dog's vaccination needs to ensure that they are covered, as prevention is always better than finding a cure. Isn't it, guys? Definitely.